Honorable Vice Chancellor Professor Nilofer Khan Sahiba, Registrar Dr. Nisar Ahmed, Coordinator CWSR Dr. Roshan Araji, Dr. Shazia Malik and Dr. Fuzia. Assalamu alaikum. Very good morning to all. At the outset, I want to congratulate Center for Women's Studies and Research Department for this initiative and innovative health camp for awareness about PCOD on occasion of International Women's Day. I thank them wholeheartedly for collaborating with our department. PCOD, as you all know, is very rampant these days, and our young population is suffering from it. And at tertiary center in ND hospital, we do see a lot of patients with PCOS, especially our young girls. But for every one patient that we see, I think there are 3 or more who don't have access to us. Either they or may not consult us due to social inhibitions. As we know, Kashmir is a very close-knit society, and any girl going to LV hospital will be looked in a different way. Hence, these awareness programs are need of the hour. This initiative will go a long way in informing and empowering women to take responsibility for their health, understand their health options, and identify the health services where they have to go. Because PCOD is not only for gynecologists, we require endocrinologists, physicians, and dietitians. We require multi-specialty, we have to have a multi-specialty approach to it. A healthy woman is an empowered woman, and I believe this health camp is an apt way of celebrating Women's Day. PCOD is the most common endocrine disorder affecting 1 in 10 women in the world, and from 18 to 44 years of age. And I was looking for the data, and ICMR data, I found that in Kashmir it is 34.3%. That is the documented data. But I think it's more than that, because there are so many people who are not documented. So it is the new emerging non-communicable disease, because now we are having stress on non-communicable disease because they are killers. So it is very important that we understand this disease, because it has long-term consequences as opposed to women in general population. Like any other, if we keep a person of PCOD and another girl or another woman, there are increased rates of menstrual disorder in a patient of PCOS, infertility, and you know what impact it has on our society, diabetes, obesity, Hersutism, acne, and in young girls having acne, Hersutism, it's devastating, and as such higher rates of depression and anxiety, and even sometimes suicidal thoughts. We have patients who do have suicidal thoughts. They go to a dermatologist, get laser done for Hersutism, come back, they again have hair growth and all that. So it has long-term consequences. Also, such patients are prone to develop hypertension, cardiovascular diseases, stroke in later life. So it has and of course, it also causes, now if a patient becomes pregnant, if a woman becomes pregnant, she can have miscarriage because of PCOD. She can have pregnancy with diabetes, pregnancy with hypertension, leading to high-risk pregnancies. So as such, early diagnosis and management is imperative to control the disease. The treatment involves lifestyle modification mainly, such as weight loss, exercise, change in dietary habits and medications. And I was very happy to see your poster. It's very good, it's very apt. These patients need counseling in addition to the treatment. Now, but the only real cure is constant, consistent and focused lifestyle change. That nothing can change that. No medication can help there. In our tertiary care hospital with quite hectic schedules, we can only focus on the treatment part. So that is why these health awareness camps are very important. And I was so happy when Dr. Roshan Araji called me that we want to have this. I was really happy, because we also need to come out of our shells and serve the community, not only in the hospital at a tertiary care center, but come out and mingle with them, help them, and have these awareness camps. But that can only happen because we are we have such a hectic schedule. We don't even think of ourselves. We don't even have time for our own family. So if we have collaboration with such departments, we can really, that time we can come out of the way and do it. So if the whole society is involved, we can go a long way in educating women about such health-related issues and help in early detection and management, and hence a healthy woman and a healthy society. If a woman is healthy, the home is healthy, the society is healthy, wealth can't replace it. I once again congratulate the department and wish a happy Women's Day. May we all have a healthy and joyous life. Thank you.